Coronaviruses are a large family of viruses which cause disease in animals. They are also called as zoonotics, means that they are transmitted from an animal to a human. And as we can see in the humans, they can cause illness ranging from common cold to pneumonia, severe respiratory illness, respiratory failure, and death. In the past as well, we have had two outbreaks, once in 2003 in China and once in 2012 in Saudi Arabia. The current outbreak, as we all know, that it has been linked to the wildlife market in China. Regarding the symptoms of coronavirus, as we have discussed earlier, many patients are asymptomatic, means that they don't have any symptoms. And the most common symptoms of the coronavirus are like a flu, and the patient will experience some running nose, blocked nose, dry cough, body pains, fever, sore throat, and some patients also report of diarrhea. These symptoms are usually mild and they will subside on its own. Some people who have risk factors such as old age, and they have medical problems such as blood pressure, diabetes, heart related issue, or when their immunity is on the lower side, patients on chemotherapy, patients who have cancers, these patients are at a higher risk of developing severe respiratory illness in the form of pneumonia or a respiratory failure. There is one more entity which is called as an asymptomatic transmission, wherein a person who doesn't have symptoms, who is asymptomatic, who doesn't have fever, who doesn't have cough, but still he is transmitting the virus. S- We are still not sure about how this happens, but definitely, yes, we have seen reports that this sort of transmission might be happening in the community, and which is far more dangerous to detect. Currently, we are doing the screening for people who are symptomatic. This asymptomatic transmission, to what extent it is causing the disease, it's still unknown and it's under trial. How does the virus spreads? This virus usually spreads from person to person through the small droplets which are coming out from the nose and the mouth of an infected individual whenever a person sneezes or coughs. These droplets, they remain suspended in the air. They also fall on the surrounding surfaces. A normal person can get this infection when he inhales these droplets, or he touches the surfaces where these droplets are present, and he touches his eyes or nose or the mouth. Thereby, he can get the virus in his system basically. So, therefore, it is also advised to stay away from a person who is sick and who is sneezing at least a meter. Regarding the treatment of coronavirus, we still do not have any specific medicine for the virus. Whatever treatment is available, it's mostly in the form of a supportive treatment. There is no vaccine available to prevent the infection. Therefore, the CDC as well as the WHO recommends good personal or respiratory hygiene to be followed to prevent the further spread of the virus. Following steps can be taken, like we should wash our hands with soap and water frequently for at least 20 seconds. If the soap and water is not available, alcohol based hand sanitizer can be used. We should cover our mouth and nose with the elbow, or we can use a tissue whenever we are coughing or sneezing, and this tissue has to be thrown into the dustbin. We should avoid touching eyes, nose, and the mouth if the hands are not clean. We should avoid any close contact with anyone who is sick, and clean the surfaces which we often touch. And if a person is sick, it's advised that he stays home, avoid going outside. Plus, it's also advised to avoid eating raw or undercooked meat or animal organs. And if there is any contact with live animals, we should frequently wash our hands. And if a person is sick and if he is not responding in when we feel that the things are not fine, it's better to consult a medical doctor.